In this presentation, we will be learning about the concept of caregiver. The presentation has been prepared by Colonel Dr. Yashwant Joshi, Vice President of National Association of Palliative Care for Ayush and Integrative Medicine. So, he has tried to expand the caregiver, where C stands for caring, A stands for always there, R stands for ready to give their all, E is encouraging, G stands for gracious, I stands for incredible, V stands for valuable, E is exceptional, and R is respectable. The objective is to encourage and better equip individuals and families who are caring for a family member with a short term or chronic illness or disability. So, it may be in various forms. Who is a caregiver? There are 4 kinds of people in this world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need caregivers, says Rosalind Carter, the former Chief Lady of USA. The term caregiver is used more in the United States, Canada and China, while carer is more commonly used in the United Kingdom, India, New Zealand and Australia. The term caregiver may be prefixed with live-in, family, spousal, child, parent, young or adult, to distinguish between different care situations and also to distinguish them definitively from the paid version of a caregiver, a personal care assistant or a personal care attendant. So, thus our family members can very well be the caregivers. Why a person need a caregiver at all? A person may need caregiver due to loss of health, loss of memory, the onset of a chronic illness, an incident or risk of falling, anxiety or depression, grief, a disabling condition, example aging. Who can be a caregiver? A family member, spouse, brother, sister, sibling, parents, etc. A friend, a volunteer, may it be from an NGO, a trained professional, assistant, nurse and others. Typical duties of a caregiver might include taking care of someone who has a chronic illness or disease, managing medications or talking to doctors and nurses on someone's behalf, helping to bathe or dress someone who is frail or disabled, taking care of household chores, meals, etc., process both formal and informal documentation related to the health, accompanying the sick person for hospital visits. You are not alone. There are almost 5 crores of Indians with some form of disability. Many of these individuals require some type of assistance or care from a family member, friend or professional. Nearly everyone will be a caregiver at some time during his or her life. Can you currently identify yourself with one of the following characteristics of a caregiver: giving assistance in time, energy and money, caring for an individual who has some physical or mental impairment, helping with many basic activities such as going to work, getting out of the house and personal hygiene, having your family member depend upon your care for their well-being. What are the challenges for caregivers for community? Understanding the philosophy, isolation from the peer group, independent spirit is a must, transportation facility has to be there, standard of living for older adults, separation from extended family. Can you think of any other points? So, here is a situation. As a caregiver, we have to be patient centric and not to trap the patient. What are the benefits of being a caregiver in a local community? We are familiar with the surroundings. Many local communities have strong informal support systems, slower pace of life, and add other issues. Caregiving is presented as offering challenges such as changes in the pace of life, changes in personal freedom, a need to reassign responsibilities, a decrease in income, a need to become more patient. On the other hand, caregiving also comes with significant opportunities such as more time to spend as a family, a renewed commitment to the family, an opportunity to learn new skills, an opportunity to reprioritize what is important to your family, experiencing the joy that comes through the service. I think COVID has taught us how to live with the family, and we have done it wonderfully since the 2 years of COVID pandemic. Caregivers stress. The stress associated with caring for chronically ill family members may result in the stress for the caregiver. The economic contribution of home care provider is not accounted for. The work toll and the loss of opportunity is there. The physical and mental drain out is also substantial. It is a huge physical and mental strain on the person. Can't seem to do enough, no time alone and no social life at all, shut out others trying to help. Loving and caring give way to exhaustion as well as resentment. Do you have caregiver burnout? You no longer find pleasure in things you once found enjoyable. Friends and family have expressed concerns about your well-being. You are getting negative feedback at work. You are having problems with your spouse. You experience intense and recurrent feelings of anger, sadness, worry or fear. You have difficulty in concentrating. You have trouble sleeping, drastic weight changes or other unexplained health problems. You use a substance to cope with, manage or suppress painful feelings. If you are having these symptoms, remember you may be suffering from burnout. Respite. Respite is the service most often requested by family caregivers, yet it is in critically short supply, inaccessible or unaffordable. regardless of the age or disability of the individual needing assistance. While the focus has been on making sure families have the option of providing care at home, little attention has been paid to the needs of the family caregiver who make this possible. So, we have to remember that caring is important even for the caregiver. What were some of the ways presented to prevent stress? Learn to laugh, keep connected with friends, allow time for yourself, ask others for help whenever required, practice good health habits, and lastly but not the least, maintain your faith. Always keep a standby. Two are better than one. If one falls down, his friend can help him up, says Solomon. How can communication be improved between the caregiver and the care receiver? This is very important. Telling the other what helps you, letting the other know you appreciate specific things they do for you. Praise openly and often, criticize privately and infrequently. Avoid sarcasm, avoidance and teasing. Touching is an important tool. Any other things if you find, add it. So, cultivate laughter. A cheerful heart is good medicine, but a crushed spirit dries up the bone, says Solomon. 1 minute of anger weakens the immune system for 5 hours, and 1 minute of laughter strengthens the immune system for 24 hours. So, be happy and learn to laugh. Have a hope. Hearts grown cold may be warmed by the summer sun. Dreams you hold may be closer than you know. Seasons change. Ray Bolts. Speak in such a way that others love to listen to you. Listen in such a way that others love to speak to you. Are the important aspects in case of palliative care. Assistive technology, whenever available, use it. Any item, piece of equipment or system modified or customized that is used to increase, maintain or improve functional capabilities of individuals with disabilities or assist the caregivers. So, here we can see the different tools are there which help the patients and caregiver too. Never give up, never, never, never give up. Winston Churchill. Thank you.